Demand for home hospice care is rising faster than manpower, with providers saying they need 20 to 30% more trained staff to keep up, roles that can take years to prepare. With more people choosing to die at home in a super-aging population, financing methods may also have to change in the future. Shalin Sia has more.
Okay, no fever.
Paul Wong found out he had terminal stomach cancer in January. The 86-year-old is choosing to spend whatever time he has left at home, including having medical checks in the comfort of his living room.
I stay here over 40 years, and I find the place here is quiet, and the neighbors are friendly. My daughter just stay next lane, and especially I had the backup. The backup is the SCC doctor and nurse team.
Paul is among a growing number opting for palliative support at home. To help more people spend their final days the way they wish to, the Health Ministry has in place a national strategy for palliative care. And since its launch in 2023 to now, home care capacity has grown some 25% from 2,400 to 3,000 places. There's also an equipment rental scheme which provides patients with subsidized essentials like hospital beds, supporting some thousands of people. But it's not just about infrastructure, as care providers tell me. The heart of care also depends on people to deliver it. And finding the right people to hire is an issue that confronts HCA Hospice Care, the country's largest home hospice provider.
One of those things I struggle as a medical director is to find the right people with the right heart to do this work. It's not terribly glamorous, to be honest, to work in the home in different settings or different families, some of which are in my opinion, not quite habitable, and I have to, within those limitations, find the means to deliver the same quality of care to that same patient, to that same family.
It looks after some 1,400 home patients and will soon increase capacity to take in more. To manage its manpower, the hospice, like many others, has enlisted the help of the patients' caregivers.
We teach some of the technological aspects, including hands-on, perhaps hygiene care, serving of medication, sometimes giving injections too, and perhaps preparing the special food, preparing some of the appliances like oxygen concentrators or suction machines that needed to be put in place.
At SCC Hospice, Singapore's largest inpatient facility, is also turning to home care to meet growing demand. Home caseload has grown nearly five-fold in less than a decade. It's about 700 today and projected to reach 850 by late 2026. That alone is putting pressure on staff training.
Every nurse that we bring in has to be trained for 3 years before they become fully competent and are able to deliver care at a standard that we expect. It is the nurse and the special skills of a palliative care team that can possibly address all these very complex physical symptoms, address the emotional needs of patients and family members, and more importantly, address all the psychosocial needs that they present with.
There are around 9 providers that specialize in home palliative care. The Singapore Hospice Council warns the sector needs at least 20 to 30% more home hospice staff as the population ages.
I think adequate remuneration would be something, and adequate recognition of their role is something that definitely is needed.
Funding is another key concern, especially when home hospice care is fully subsidized.
We will come to a point sooner or later where home hospice should be chargeable, but chargeable doesn't mean expensive. I think if it can be drawn from the MediSave as well, this will actually enable families to still have the wish of the patient passing on at home, and without having to fork out of cash by themselves as well.
Policymakers consider potentially open up, say, MediShield Life to support home hospice care. Currently, it can be used in the hospital, in the inpatient hospice facility, but it's not quite possible to use MediShield or an insurance for that matter to pay for home care.
CNA understands the council members regularly engage with MOH on the future of the sector, including financing.